Hi, my name is Shay Reitler, and I will be demonstrating an intradermal injection. First, you want to make sure you have your six rights: right patient, right medication, right dose, right time, right route, and right documentation. You also want to do your 3 checks: 1 check before you pull meds out, 1 check after you pull meds out, and 1 check at the bedside. So first, I would go into the med room, do my checks, check my patient's MAR, check for allergies, check the doctor's orders, make sure everything's okay. And then for the intradermal, it's most likely a tuberculosis exam. So I'm just going to warm this up. And to draw up, first I'm going to wipe the top with an alcohol wipe. And if this was a single dose vial, I would just open it, wipe it with an alcohol wipe, and use it as needed, and then throw away the rest. If it is a multi-dose vial, I'm going to check the expiration date. I'm going to check that the last nurse signed, I believe it's 28 days from when opened. And if I was opening a new multi-dose vial, I would sign my name, date, time, and 28 days from when I'd opened it. Throw this away. Next, I'm going to open my syringe. Just going to carefully, first I'm going to draw up the amount that I'm going to take out. I'm going to undo my syringe. I'm just going to push my air in there. And then I'm going to draw up the amount that I had put in air. I'm also checking for bubbles and just tapping those out. I'll put my solution back down. I do have a little bubble. And then to recap, I'm just gonna swoop down, and get this, and then I will grab it and connect. So now that I have my intradermal injection, I'm going to go to my patient's room, identify myself, explain what I'm doing. So I'm doing an intradermal injection for a TB test. I'm going to check my patient's name and birth date using those 2 identifiers. I'm also going to assess their allergies just to make sure when I get back in there. And then I'm going to go back over my 6 rights and just make sure I do have the right patient and know their allergies. I do have the right medication, I do have the right dose, I do have the right time, and am doing the right route. And then when I'm finished, I will do the right documentation. So on this injection, typically it's on the forearm here. So I'm just going to put my gloves on. And first thing you want to do is take an alcohol pad, and you're just going to rub from inner to outer. And I'm going to uncap my needle. And this injection is at a 5 to 15 degree angle. And you're just going in about 1/8 an inch right under the skin. I'm going to slowly inject my medication. And I can see my little wheel. You should get about a 1/4 inch wheel. I'm going to take this out. This one doesn't have a safety cap, so I'm going to safely recap this and put it in my sharps. If they were bleeding, I could take a gauze pad and just wipe up the excess solution around. You don't want to put a Band-Aid on the intradermal just because it can affect the wheel. And after this, I would also take a pen and circle the wheel just to verify that when the patient does come back in 48 to 72 hours that I can identify where that spot was and identify and assess any changes. And that's it. And now I would document document my injection, and just educate my patient on the importance of coming back in the 48 to 72 hour range, just so that can be reassessed. And that is it. Thank you.